Have you ever wondered what the first few days after robotic total knee replacement should really look like? And what exactly is the right physiotherapy routine to follow? In this video, Dr. Prashant B. Jain will explain about post-robotic TKR care physio. First phase.
Hi, I am Dr. Prashant B. Jain, Senior Robotic Orthoplasty Surgeon. So today we will discuss about care that you take post-robotic knee replacement surgery. So the care care or physiotherapy that will divide into three phases. The first phase is when till the wound heals, from the day of discharge till the wound healed, so that you meet a doctor and take the suture out. And second phase is from the day you take the suture out till you are walking comfortably without a support. And the third phase is after you started walking without a support. First phase is usually roughly first 3 weeks from the discharge. Second phase is from 3 weeks to roughly 6 weeks. And third phase is usually post 6 weeks. So in the first phase, our main concentration is to decrease the pain and to make sure that the wound heals without any inflammation or infection. So this first phase, we mainly consider the tissue healing process, for which the most important thing we require is RICE, what is called RICE, which is rest, ice, elevation. So whenever you relax at your home, it is very important that you keep the leg elevated over a pillow so that there is a good circulation of the leg, and keeping it elevated and repeated ice application to the operated area. Usually would have a dressing that is water resistant, or that if you apply ice repeatedly, the amount of inflammation will be less, amount of pain, swelling will be less. That helps you in smoothly carrying out exercises. And definitely too much of walking in the first phase is not good, which causes pain and swelling, which impairs your post-operative progress. Okay, so and it is very important to take the medication that were given, mainly anti-inflammatory or pain medications. So these medications helps in decreasing the inflammation, mainly in decreasing the swelling, so that your movements comes comfortably and you sleep nicely, relax nicely, so that healing process is good. Many of the time you feel that pain is not much, you tend to avoid pain medication thinking that it has multiple side effects. But this indirectly affects the healing, wherein your progression, your recovery becomes slow. That's why in the first phase, it is very important that you are very liberal on pain medication and ice application and rest. So coming to the exercises. So in first phase, exercises are mainly to heal the wound and make the circulation better in the leg and the body. So to increase the circulation in the body, what is called ankle pumps, where you keep the leg straight and moving your foot upwards and downwards. Moving your foot upwards and downwards. So this would work like a calf pump, where the circulation from the leg to the body and body to the leg is gone good. Okay. Second exercise, where you keep leg over a chair or something, and where the lower part is relaxed, slightly forcing the leg down so that your complete extension is achieved, and then relaxing. Completely extending, probably holding 10 counts, and then relaxing. So this you do 5 to 6 times, so that your complete straightening of the leg comes. In the first phase, it is very important that you achieve complete straightening of the leg. And the next exercise is slowly bending the leg and extending the leg. So this bending and extending the leg can be done for your comforts, which should not be forceful, that causes pain. Okay, and the other exercises are mainly for your body. That includes your breathing exercises, your spirometry, which your physiotherapy would have taught you when you are in the hospital. This is the care that you give to your wound till the wound heals completely. Thank you.
Follow us to know about the later phases of your recovery journey. Make an appointment for expert total knee replacement.